Agency, Associate Professor in Mental Health Nursing. One of the treatment options that we use in psychiatric nursing is the therapies. So, in the therapies, you've got various types of the therapies based on the condition of the client, based on the situation of the client. Where the psychiatrist or the psychotherapist, will actually decide what type of the therapy is going to suit for the client. One such therapy wherein it will help the client to have an interaction, to understand about the client's environment, to develop the socialization skill, and also live with the community is called as the therapeutic community. So today I'm going to talk about the topic milieu therapy or the therapeutic community. Let us see the definition of milieu therapy. Therapeutic community or the milieu therapy is one of the psychiatric nursing approaches wherein the patient's social environment will be used to provide therapeutic experience for him by involving him as an active participant in his own care and daily problems of his community. So, what is this milieu therapy or a therapeutic community? Wherein the client will be placed in an environment in the social setting when he will be learned how to function independently in the community setup or in the particular environment, meeting his basic needs or the daily needs, or how to solve the problems in the community. So that is what is done in the milieu therapy or the therapeutic community. If you take the word meaning of milieu, it means the environment of the client, or we can say the setting of the client. So we can say that milieu therapy refers to the people and all the social and physical factors in the environment with which the client will deal with, or we can say with which the client interacts. So that is called as the milieu therapy. It is a setting wherein we have got the social factors, we have got the physical factors with which the client will live in, and he will interact with those factors. So that therapy is called as the milieu therapy, otherwise called as therapeutic community. Let us move on to the objectives of milieu therapy. Number one, to use the patient's social environment to provide the therapeutic experience for him. So here we have got a social environment wherein we have got the people, we have got various other factors which is going to bring about an experience for the client, like how he can deal with the society. So that is what the objective of the milieu therapy is. He will learn how to interact with the environment, which is going to be a form of a therapy or a treatment for the client. The second objective is it enables the individual to actively participate in his care. It can be a daily living, or it can be meeting his own basic needs and the meeting the needs of the community. So all this, the individual will get an opportunity to participate, which can boost his confidence and his energy. The third objective is it is going to help the patient to solve the problems, various problems which comes across in his daily life or in the community. He will be able to solve the problem, make his own decisions. He will be able to plan the various activities and develop various rules and regulations for the community. So it is an opportunity wherein the client actively involves himself in planning for his own self as well as for the community. It can be related to various rules and regulations, or meeting the problems and solving the various problems of the community. So all these things is done about by the milieu therapy. The next objective is it is going to increase the independence and also gain control over the various aspects in their personal life. So there may be so many concerns related to the personal life wherein the client may not be able to make decision. So he may seek the help of the other therapist or other people. But when he is in the milieu therapy, it is going to give him the autonomy or the independence to deal with his own personal problems, to solve his own personal problems by himself and make decisions for his personal life. The next objective is it enables the client to become aware of their behavior and how those behavior is going to affect others, right? So there are behaviors in the patient which can affect the other person. So here through the Milieu therapy, it is going to give an opportunity for the client to understand what are the behaviors that is acceptable, what are the behaviors which needs to be modified, right? So that is what the Milieu therapy is going to help the client. So this is about the objectives of the Milieu therapy. Moving on to the functions of the Milieu therapy. Number one, it provides the shelter to the client. So when the client is there in the preset environment, it is a kind of a safety and security. All the needs of the client will be met. So it gives a shelter to the client. The second function of the Milieu therapy is it will protect the client in terms of the physical protection, the emotional protection, or the security. The client feels safe when he is there in such a kind of a community. So we have got individuals, so many patients who will be living in the same old setting or the environment. So it gives the protection to the client in terms of physical as well as the emotional. The next function is it supports the psychological existence of the client. Next one is it provides pleasant, attractive and sensory stimulation, right? So if you take the environment or the milieu, okay, so the environment is such that it should be very pleasant, okay, and it should bring some activation to the sensory stimulus or the sensory areas of the person, okay. It will be stimulated when he's there in such a kind of calm, pleasant environment. The environment should also be such that it is very attractive to the client. So if you can go and check out various settings related to the Milieu therapy, the settings will be such that it is mainly of the nature. So amongst the nature, we have got a physical setup wherein all the patients stay together in the particular physical setup or the environment, and they even have got the freedom to just go about the particular environment and get the fresh hair, and the environment is such that it provides a relaxation and the sensory stimulus which is going to calm down the patients, which is going to make the patient's mood to be very much pleasant, right? So that kind of an environment the Milieu therapy will provide. The next function is it is going to provide education to the client as well as his family. So at the end of the therapy session, okay, so it may become necessary that you have to give the education even to the family members. So Milieu therapy is going to be a beneficial one wherein the client as well as the family will be given the education as to how to go about further in their life and how to make their own decisions, how the family has to support the client. So all these education will also be a part of the Milieu therapy. So this is about the functions of the Milieu therapy. Moving on to the elements of the Milieu therapy. The first element is the free communication. So when I say the free communication, the individuals or the client have got the freedom to communicate. Okay, it is not a rigid environment when the client is feeling very sophisticated. Okay, no, the environment is such that it promotes the free communication and the socialization. Through the communication, will the therapist know what are the ideas or thoughts or feelings of the client, what are the emotions of the client. So when an individual is able to communicate with the other people in the particular setting, he will be able to express his thoughts, he will be able to ventilate his feelings, which is going to be a form of therapy for the client. So Milieu therapy is going to help out in free communication. The next element is shared responsibility. So when it comes to shared responsibility, what is it is happening in the Milieu therapy. So if you take a therapeutic community or a Milieu therapy, each and every member or each and every client, according to their capacity and capabilities, they'll be given some roles or they'll be given some responsibilities. So each and every client has got some responsibility or role to be fulfilled. So that is what is shared responsibility in the community or a therapeutic milieu. Each and every member will be given the responsibility to take care of, which is going to again, boost the client's enthusiasm and confidence when he takes up the responsibility. The next element is the active participation. So active participation is each and every member in the therapeutic milieu is an active participant. He actively participate in terms of various group activities, in terms of various responsibilities or roles what is given to him in planning, okay, in planning various games or activities, recreations, okay, all these things which are happening, each and every member supposed to be an active participant. The next element is involvement in decision making. Again, so in various concerns or issues when it comes up, so when a community or when people are living together in one set environment, there are so many concerns or problems that may rise up, right? So in those situations, the individual will freely communicate to the group and they will be able to make decisions not only for themselves and also for the other people, and they will come to an amicable solution. So that is what is involvement of the group in decision making, so that the whole group will work together and uplift themselves. The next element is understanding of roles, responsibilities, limitations, and authorities. So each and every member, according to their capability or capacity, they will be placed in different position or different roles, and the responsibilities will be carried out by each and every member. So the other individual or the other client shouldn't feel very low. No. So based on the capacity, each and every member will be given the roles and responsibility and the authority, and the other members should abide to each other. They have to have a coordination and cooperate together so that they will lift up themselves. So that is what they need to understand in the therapeutic community. Each and every client has to understand their roles, responsibilities, the limitations, as well as their authority, how to carry about their own self. Okay, so these are the elements of the therapeutic community. Moving on to the characteristics of the therapeutic community. Number one, respect. So one of the important characteristic is respect. Each and every member in the therapeutic community should respect each other, right? They should have a mutual respect for each other. It can be respective of their roles and responsibilities. They should have the dignity, and also they have to maintain the mutual respect. The next characteristic is share decision making. So each and every member should be able to make a decision, will be given an opportunity to make the decision, and also that decision, whatever they made, should be acceptable by the community or by the other clients who are staying together. Okay, and at times it becomes necessary that they communicate and they take the help of each other at times when it is not possible to make the decision. So they share their decision making and work together. The next characteristics is the therapeutic milieu will use the mechanism of meetings and groups to develop openness of communication. So say for example, at the end of each week or at the end of each day, they will gather together. They form a group and they will discuss what are the things which happened this particular day. Was there any concerns? Okay, so was there any problems that has to be solved? Okay, so all these things, they will form a group and conduct the meetings frequently so that the whole community or the setting or the milieu will get the solution for the particular issue. So if you take a Milieu therapy, there will be frequent meetings or group gatherings where they will be, communicating freely and addressing their concerns and sharing their ideas, and they will come to a conclusion or a decision. Moving on to the components of the therapeutic milieu. If you take a therapeutic milieu, what are the things which actually goes on? If you take from a particular day, what is the usual routine which is being done in the therapeutic milieu? Let us see the components. The first one is daily community meetings. If you take the daily meetings, there will be about 60 to 90 patients, wherein all the people who are working in the therapeutic milieu will be an part of the meeting, right? It can be unit staffs or administrative personnel. So all these people, even the clients, will be present in the meeting. So a group of 60 to 90 will form a group for the daily meeting. And one of the important thing is we don't include the acutely ill clients. So these acutely ill clients may need the treatment. So those clients will be excluded. So other clients will be included in the particular meeting along with the various other personals working for the therapy. If you take the timings of the meeting, the total duration of the meeting, it takes about 1 hour. The meeting should be conducted for at least about 60 minutes. The topic of discussion for the meeting is mainly about the day-to-day life. What are the issues which happened, whether the routine happened, as usual. Was it the normal routine? Was there any difficulties or any concerns? So related to the day-to-day life in the particular unit. So that will be the topic of discussion in the daily meetings. So important thing is during the meeting, the patient's feelings, the patient's thoughts and behaviors will be observed by the therapist or the other paraprofessionals who are there working for a milieu therapy. So mainly we are going to focus on how the client is going to express, how is he going to communicate, what are the behaviors that he is going to exhibit, what are the feelings or the emotions that he is going to just pour out. So all those things will be observed by the therapist or by the various paraprofessionals. So if you take the overall daily meeting, frank discussions will be carried out in, it will be encouraged, and at times there may be, the feelings will just outburst in terms of anger, in terms of crying spell. So all such feelings will just projected out via the group meeting. So it doesn't mean that you have to discourage the client not to do such, behavior. No, it should be such that the group should encourage the client to just open up and talk, which is even going to help the client to let out or ventilate his feelings or thoughts. So this is what is done in the daily meetings. The next component is a patient government or ward council. So as you know, in the therapeutic community, we have got clients who will be assigned with the various roles and responsibilities. So in the council meeting or in the patient government, so what will be done is such patients who have got their authority or the responsibilities, they will form a group and they will be conducting the meeting in the patient government. So the purpose of the patient government is to deal with the practical unit details, such as it can be housekeeping, activity planning or the privileges. A group will be formed which consists of 5 to 6 patients who have got the roles and responsibilities to carry out, such as housekeeping, physical exercises, personal hygiene, meal distribution, a group to observe the suicidal patients. So like that, when each of the responsibility is given, such patients, okay, will form a group and they will be conducting the meeting. So whatever the issues are related to such kind of various responsibilities like housekeeping, or it can be the personal hygiene, or it can be physical exercises, any concerns, any problems which are faced, they will sit together, they will make the decision, and they will come to a conclusion. And whatever the decision of the group or such kind of a patient government is done, so that should be communicated to whole of the community or the therapeutic community. So through the community meetings or the daily meetings what is being conducted, so whatever the decisions which the patient government or the council meetings had happened, they will be giving a feedback to the whole of the community when they conduct the community meetings. Okay, so that is about the patient government. The next component is the staff meeting or the review. So what is done here? Here the only the staff members will form a group and they will be conducting the meeting. So all the patients will be excluded. Exclusively only the staffs or the, you can say, the therapists or the paraprofessionals, they will form the group and they will be doing the meeting. So after each of the community meetings, this staff meeting will be conducted. So in this staff meeting, they will be observing or they will be examining their own responses, expectations and prejudices. Okay, so this is what is done in the staff meeting. So exclusively for the staff members, after the community meeting, they will form a meeting and they will be examining their own self, their own prejudices or any concerns they will be addressing in the meeting. The last component is the living and learning opportunities. So learning opportunities will be provided to the patients, to the community in the community therapy or the Milieu therapy. Each and every patient will be seen to it that the realistic learning will happen in the client. So at the end of the Milieu therapy, the education should be benefited by the client. So a learning should happen, how to interact with the society, how to exhibit or show their behavior, what are the behaviors which are accepted and which is not accepted by the society. So all these learning will take place in the therapeutic milieu. So it is an opportunity for the client that he learns something and he learns how to live in a community. So that is what is the components of the milieu therapy. Moving on to the assumptions of the milieu therapy. Number one, the health in everyone should be realized and encouraged to grow. Okay, so each and every person should understand what is the meaning of health and they should be encouraged for the promotion of the health. Okay, so that is what is one of the assumptions of milieu therapy is for the promotion of the health and well-being. The second assumption is every interaction is an opportunity for therapeutic intervention. So whatever the interaction that happens in the milieu therapy, the main purpose should be that it should benefit the client in terms of treatment. Okay, so that is one of the assumption of the milieu therapy. Any kind of a communication which is done, make sure that it is going to help the client in terms of the therapy or the treatment. The next assumption is the client owns his or her environment. So what is this? The client is responsible for his or her own environment. That means the therapeutic milieu when you take, it can be the setting of the client, the room of the client, the whole environment in the therapeutic milieu. It is the responsibility of the client to take care of his environment, to take care of the other people who are there in the environment. So that is the very important assumption that he should feel responsible of his own environment. It can be the physical setup or it can be the people around him, that she should be responsible for that. The next assumption is each client owns his or her behavior. That means each and every client is responsible for his behavior. Whatever the behavior that he exhibits, whether it's adaptive behavior, maladaptive, accepted behavior, unaccepted behavior, okay, good behavior, bad behavior, whatever it is. So what behavior he shows, he is responsible for his behavior. He should be able to have the control over his behavior. He should be able to manage his behavior and emotions. So he owns his or her behavior. The next assumption is peer pressure is useful and powerful tool. So, what is this peer pressure? So, if you take a therapeutic milieu, it is not only the patient who is there, we have got so many people around him. It can be the other patients, it can be the staffs who are there working with the client, right? So, every member is, a peer, okay, who is going to make the client to learn something. So, it can be a pressure from the peer, which is going to become a powerful tool for the client to modify himself, to bring about change in himself. So the other person is going to just encourage the client, who's going to just give him the positive reinforcement. So the peer becomes a powerful tool for bringing about change in the client. The next assumption is the inappropriate behavior are dealt with as they occur. So, at times when there is a group, when they are living together, there may be chances that a lot of, miscommunications can happen, so many problems can arise. So, behavior what is exhibited can be an unacceptable behavior. At times, a client may show aggressive behavior. So, whenever such behaviors are exhibited, they should be noted and it should be dealt with then and there itself. It can be a negative reinforcement or behavioral modification that requires to be done. The therapist has to understand that and he has to deal that particular behavior then and there itself. The next assumption is restrictions and punishments are to be avoided. So as much as possible, you see to it that you motivate the client, you encourage the client, you be with the client and help the client to get that positive energy within him, rather than restricting the client, limiting the client, or punishing the client when he does some mistake. Rather than that, you always, as a therapist or as a health professional, should be able to motivate the client and avoid such kind of restrictions and punishments. So that is about the assumptions of the therapeutic milieu. Moving on to conditions which promote a therapeutic milieu. So we have got some conditions or points that has to be kept in mind when a therapeutic milieu is being conducted. So what is that? First one, basic physiological needs are being fulfilled. So it means that the basic physiological needs, it can be the food, the shelter, the air, water, meeting all these, sleep and rest, all these basic needs are to be fulfilled when the client comes for a therapeutic community. So if the basic needs are not met, the client will not feel the safety, protection and comfort, and he will not be able to carry on or move on with the therapeutic community. So firstly, you have to see to it that all the physiological needs or basic needs of the clients are fulfilled when he comes for a milieu therapy. Second thing is you have to see to it that the physical facility or the physical environment should be conducive to achievement of the goal of the particular therapy. So the physical setting was also very important. You see to it that as much as possible it is conducted in the natural setting, which should be very attractive. The pleasantness, the calmness should be maintained, and some sensory stimulation cues should be present in the environment, which is going to uplift the mood of the client. So the whole goal of the therapy should be fulfilled. So before that, see to it that the physical facility is conducive for the therapy sessions. The next one is a democratic form of self-government exists in the therapeutic community. So what is this democratic form of self-government? So each and every member has got a role and responsibility. He is responsible for his own environment. He is responsible for his own behavior. So he is responsible to make his own decision. So he is having the democracy or independence of freedom to make the decisions. So that is what is the client is having, the self-government to decide and to see to it that everything is happening well. So that is an important condition for a milieu therapy. Next is responsibilities are assigned according to the capacity or capability of the client. So based on the capacity of the client, each and every client will be given the responsibilities or the roles to carry out. Okay, so which is going to again boost the confidence of the client and self-esteem is going to be increased. Okay, so that is what is the responsibility which will be assigned based on the capacity of the client. So as a part of the treatment program, there is a structured program which will be conducted in form of the various activities, social gatherings. So all these will be carried out. The activities, privileges will be given to the client to plan, okay, to make the decision, to plan the programs, okay, that has to be conducted in the therapeutic community. So at the end of the treatment, okay, the community and the family will be included in the therapy sessions so that we can plan for the discharge of the client. So we can give the education to the family as well as the client so that he will be ready for the discharge and to be placed in the back to the family as well as the society. So this is about certain points that will promote the therapeutic milieu. Moving on to the program of the therapeutic community. So if you want to conduct the program, the first and foremost is we should have a team. So the team is interdisciplinary treatment team. So it is called as IDT, interdisciplinary treatment team. So that should be there. So if you take the IDT team, we have got the team members who are the psychiatrist, clinical psychologist, psychiatric clinical nurse specialist, psychiatric nurse, mental health technician, psychiatric social worker, occupation and recreation therapist. We have got the music and art therapist, psychodramatist, dietitian, and chaplain. Okay, so these are the members of the IDT team. The second requirement for a program to go on is the initial assessment. So what is done in the initial assessment? So when the client comes for a therapy, you have to review the client, you have to observe, take the history, do the assessment, observe the behavior of the client, do the mental status examination, find out the strengths and limitations of the client, the likes and dislikes, the interests of the client, so that it will help you in planning further, right? So that is what is the initial assessment which is done in the program. The next step which is done is comprehensive treatment plan and goals of the therapy, as well as assigning the interventional responsibilities. So based on the assessment, whatever you have done, you're going to plan the goal. So it can be a short-term goal or a long-term goal. You're going to set the goal and you're going to give the treatment plan. You're going to give some responsibilities based on the capability of the client. You're going to plan the interventions. You're going to give the responsibilities and roles for the client. The next step what is done is once you have decided with the treatment and with the goal, you have to see to it that all the members in the particular community or the treatment team are going to duly sign the treatment plan and also meet regularly. So daily basis meetings that they will be conducting. So they have to meet together and address their concerns and find out the solutions and work together as a group. Okay, so that is what is the overall program of the Milieu therapy. Moving on to the principles of the therapeutic milieu. The first principle is responsibility of the therapeutic milieu or the treatment belongs to the staff and the client. So the overall responsibility, if you take, it is the responsibility of the client himself as well as the staff, the IDT team. So that is the responsibility of the treatment or the therapeutic milieu. The next principle is the roles are equalized. So each and every member equally they will be given the various roles. Okay, so various roles will be assigned. It can be to the IDT team or to the clients. So every member they will be given the roles and which is uniformly been decided based on the capacity of the client. So the roles will be equalized. The third principle, democratic environment is fostered. So each and every member have got the democracy or the independence to communicate, and also the team is going to encourage the client for the open, free communication. So anytime they can address their concerns and it will be. The next is focus on the client. Yes, even though the client is given the responsibility, roles and responsibilities, all those things, as the IDT team, Okay, you have to always focus on the client. So you have to see to it that you make the assessment. You observe the client, you observe the behavior, observe the thoughts, feelings, how he's going to communicate, how he's adapting to the community or to the therapy. So all those things should be carried out by the IT team. So the focus should be on the client. The next principle is peer pressure to reinforce rules and regulations. So what is this here? We have got the various people or the various other patients who are going to reinforce the community or the therapeutic community in terms of the rules and regulations. As and when it is required, the rules and regulations can be modified by conducting various meetings and coming to an amicable, response or a solution. The next principle is there should be an interpersonal interaction to improve communication skills. So how it is done, various activities will be planned for the groups or for the patients. They will be involved in group meetings, conducting various social activities or the games or various other activities that will be planned, so which is going to improve the interpersonal interaction as well as the communication skills. The next principle is inappropriate behavior are dealt with as they occur. So as and when there is an inappropriate behavior which is shown by the client, so that has to be dealt. The team, IDT team has to address the client and also solve his whatever problem and try to bring about modification in the behavior. Next is team approach is used. Okay, so when you are working together for a therapeutic community, you also have to keep in mind that you always use a team approach. It is not only the it is not only the psychiatrist or the psychotherapist who has got the responsibility, or psychiatric nurse, social worker. You're working as a team. Okay, we require the treatment from every member of the therapeutic team. So you work together and plan the best thing for the patient, right? So a team approach should always be used when you plan for a therapy for the client. The next principle is we use the meetings to teach the standards, values, behavior, exploring the behavior, make decisions for solving various problems. So via the meetings, all these things can be addressed. So timely, the meeting should be scheduled and it has to be conducted so that the concerns of the client, the values of the client will be improved. So this is about the principles of the therapeutic community. Moving on to the advantages of the therapeutic community. Number one, patients develop the harmonious relationship with the other members in the therapeutic community. Yes, so when the client is there in a social group, it is going to teach the client how he has to behave in the society or in a particular group. It's going to improve the communication skills. It's going to improve the interpersonal relationship, right? So patient will develop the harmonious relationship and how to deal with the community. The second thing is it is going to help the client to gain the self-confidence. When he is assigned with different roles and responsibilities, which is making him to take the appropriate decision, it is going to boost his self-esteem as well as he will be able to gain the self-confidence. The next advantage is it is going to enable the client to develop the leadership skills. So when he is given the different roles and responsibilities, it automatically comes out in the client that he develops the leadership skills to deal with various situations. It can be to deal with various concerns. He will learn the leadership skills. The next advantage is going to learn to understand and solve problems of self as well as others, right? So when he is there, given the responsibility, given the opportunity, he is going to learn to solve his own problems. Not only that, to also help out the other people in the therapy, right? Is going to solve the problems of the other individuals also. Next advantage is the client will learn to live and think collectively with the members of the community. So he is going to stay with the community, he is going to live with them. Not only that, he is going to think collectively. He's not going to think about his own self, but for the community, for the whole, group of the patients, is going to collectively think. Whatever decision he makes is not only for himself, but for the whole of the community. So that kind of a thinking that he will develop when he is there in a therapeutic community. Okay, the very important responsibility of a therapeutic community is it is going to provide opportunity for the client to participate in formulation of various hospital rules and regulations that will affect the client's personal liberties like bedtime, meal time, weekend permissions, control of radio or the television, social activities, late night privileges, etc. So all these are the privileges which the client will get in the therapeutic community. So he will be given an opportunity to form the rules and regulations related to all these activities. Right? So these are the advantages of the therapeutic community. Moving on to the disadvantages of the therapeutic community. First one is the role blurring between the staff and the client. Okay, at times there will be a confusion or there will be some issues related to the roles and responsibility which can happen between the client as well as the staff members, right? There may be the collision which can happen. So that is one of the disadvantage, because as I told you, each and every member in the group is having the role or the responsibilities. At times when the treatment team members, okay, they just come to the clients and try to try to discuss certain issues or things. So there may be collision between the client as well as the staff members. The next disadvantage is group responsibilities may become nobody's responsibilities. So each and every person in the group may not take up the responsibility as a responsibility of the whole group. Some may just neglect it, so some may just put on others. So nobody is there responsible for the group, right? So sometimes it can happen the other way. When the group responsibility is given, individual responsibility will be neglected. The next disadvantage is individual needs and concerns may not be met, right? Even though you're in the group and there is a collective thinking of a group, at times the individual needs cannot be met. Okay, so that is the one of the disadvantage. The next disadvantage is the patient may feel transition to community as very difficult. Okay, so he may feel the transition or the change or modification that he has to make for the community, to be in a community, he may feel very difficult. Okay, so that time he feels very stressed or very much anxious, right? It can have an impact on the client as well. So that may be a failure of the therapeutic community. So this is about the disadvantages of the therapeutic. Moving on to the nurse's responsibility, nurse's role in the therapeutic milieu. First one is nurses will use the nursing process, right? So you know very well, initially you have to do the assessment, you have to set the goal, you have to plan the treatment, you have to implement the plan and evaluate the plan. So when the client is there, you're going to focus on the client in terms of observing his behavior, making the various assessments. You're going to set the goal for the client, you're going to plan the intervention and also evaluate the client. Okay, that is the first responsibility. Second one is provide the direct client care. So as a nurse, you are there. So at times when the clients feel very low and the clients feel very, helpless to meet his, basic needs, it can be, or the emotional needs, you are there, to give the direct care to the client. The next responsibility is you're going to administer the medication and also give the medication teaching. Yes, client is there in the therapy, doesn't mean that he requires any kind of a treatment. No, he may require the psychopharmacological help also. So you're there, you're keeping a tab, you're going to administer the medication at the right time, you're going to educate the client in terms of the importance of taking the medications. So that is what is the responsibility of a nurse. The next is you provide the psychosocial care. So you educate the client, you help the client to interact with the other people, you help the client to be in the social setting, you plan for the various activities, so you provide the psychosocial care to the client. The next responsibility is you give the mental health teaching to the client. Yes, how to promote his mental health, how to improve, how to use the various coping mechanisms. So all these in terms of teaching that you are going to provide to the client. The next responsibility is you are going to encourage the client to help and support each other when they are there in the group. So you teach the client about we feeling, you teach the client about responsibility of not only himself but also the other people in the particular group. So you encourage the client to help himself as well as the other people who are there in the therapeutic milieu. The next one is you're going to assist the client to understand each other's feelings and problems. Okay, so you're going to help out the client to make him understand about the feelings of other people, of himself, and also the problems and how to help out the other person to solve his problem. Next thing is you're going to conduct the community meetings. So you're an important member of the community meeting, the daily day meeting that you will be conducting, wherein you will be observing the client's behavior, his feelings, his thoughts, his emotions, how he's interacting. So you will keep an eye on the client so that you will understand and do the modifications and assign the responsibilities according to the client's capabilities. So that's what you're going to provide, or you're going to make sure that you involve the client in the community meetings. The next thing is you're going to freely participate in the milieu therapy. So how you're going to freely participate? So at times there may be various games which are conducted, various activities which you will conduct for the client. So you as a nurse, you should be a part of the milieu therapy. Even you have to participate in the various games. You have to become one among the patients, participate with them. It can be the craft, it can be the exercises, it can be the various group programs. So you involve with the client, participate with the client in the community therapy. So this is about the therapeutic milieu. Very interesting. A client should gain self-confidence, should be able to make decisions, carry on his day-to-day activities, okay, and help himself out at times, right? So all these can be done, okay, when you place the client in the setting which is a therapeutic community, wherein he will learn the skills to not only help himself but also to help the other people and modify his behavior according to the needs and the requirement of the society. Hope you all have understood the topic. Thank you.